taking pain away is not really rocket science. It is not that difficult. If we can teach any residents, any junior doctors in 1 or 2 hours to manage 90% of all children with acute pain. So it's not all that difficult. However, most children's hospitals have not yet implemented even the standard methods of taking acute pain away. Chronic pain in children is a huge problem. More than 8 million children and teenagers in the United States suffer from chronic pain bad enough that they miss school. Chronic pain means that following a thorough workup, pain remains beyond the expected time of healing. Meaning many children may have had a minor or even a big surgery or an injury. They may have had an infection. And we would expect that they heal and the pain goes away. And in some of our children and teenagers, the pain just remains for days, weeks, months, and years until we see them in our clinic. It's very important for a chronic pain patient who's coming to us to actually be able to tell the whole story. And rather than by doing this over and over and over again, we actually have all specialists in the same room at the same time. This is the pain clinic. Are you ready? Brooke, as I told you, there are actually lots of people in the room. The main reason that we have 5 people in the room is obviously that it's pretty boring to tell your story over and over again. And since we don't want you to go from one person to the next person to the next person and answering the same boring questions over and over again, what's going to happen is only today, for the when we meet the first time, that we're actually going to go all the questions together. There is a nurse or nurse practitioner.
I'm the person who coordinates the clinic for patients who are actively participating in the program. So I'm the person you call when things are going well. I'm also the person you call when things are not going so well.
We have a physical therapist specifically trained in dealing with kids with acute and chronic pain.
So I deal with everything related to movement. So sometimes when people are in pain, they stop moving normally or they stop moving at all and they stop doing the fun things that they want to do. And so they get weaker and they lose endurance. And so I kind of help you build up your endurance and strength and get you back doing the things you want to do.
We have a social worker and family therapist.
Most of my work would be with your parents. A lot of what I do is focused on education around chronic pain, and often parents have questions about parenting. How do they support you and help you while still parenting?
We have a psychologist who is trained in integrative non-pharmacological modalities.
So I work mainly with you, and I would teach you the non-medicine ways of how to get rid of pain. And then also usually people who've had pain for a long time, their life isn't so great, and you're not really doing the stuff that you want to be doing. So I'd help you try to get back to those kinds of things as well.
And last but not least, there's a pain doctor. I'm going to ask you gazillions of questions today. I'm going to examine you. I'm going to check out your medications. Are you ready for 8,226 questions?
Bring it on.
We'll do that. Active listening in an interdisciplinary team tells us things which are going on we may otherwise miss. The large majority of kids who come to us, they do not feel believed. They feel that doctors or hospitals don't believe them that pain is real, because when they do all these tests, when they do the ultrasound, when they do the MRI of the brain, if they do an X-ray, they don't actually find anything wrong on those pictures. Okay, so number one, before I tell the good news, I think your pain is real. I don't think that you're crazy, I don't think that you're faking it, I don't think that you're making it up. This is real pain. However, I need you to do 4 things at the same time. And the hard thing is, if you do the 4 things at the same time, sometimes pain even gets worse before it gets better. The number one thing is physical therapy, is exercise. Often what happens if I'm in pain is that I actually become less active. And then when I become less active, I'm in more pain, so I become less active. It's often a vicious cycle. Those kids become often very deconditioned and do not do very well. You need a personal trainer. Within the next few weeks and months, I need you to get back on the soccer field, or whatever you want to do. You may change your exercise, you may change your sport, that's totally fine. But I clearly need something where you exercise every day, where your heart rate goes up. However, if you do this, what may happen to your pain?
It'll get worse.
It may get worse for a bit. So you need to know this and you guys need to know that. The second thing which I expect all my patients is to learn one active distraction technique.
She hasn't done any active coping. She hasn't done any of the integrative medicine outside of the hospital, so I mean, we have a lot that we can offer.
So I need to do one active thing every day. Easy would be something like deep breathing. What else is there? Well, we can teach you right here progressive muscle relaxation. It's a technique where you tense and relax certain groups of your muscles as you sort of go through your body. We can teach you the really cool biofeedback. Biofeedback is actually playing a video game, but you do not have a joystick, you don't have any buttons. The way to play the video game is we're going to put a probe around your finger and it's going to measure your heart rate. And by relaxing your heart rate, you actually will be able to decrease the pain. And you will see this on the computer as you can play the video game with that. Or I can actually teach you my absolute favorite before you leave this room today, which is hypnosis. What I can teach you, and it takes me about 10 or 12 minutes, is actually how to imagine going to Hawaii or whatever your favorite place is. When you are so relaxed that you actually enjoy being at your favorite place, then there are a few tricks where you can actually play on those pain switches. I only need you to practice one of those things every day. The third thing is to actually work with one of my pain therapists, the pain psychologists. We often found that clearly pain causes a lot of stress, and stress causes more pain. So we all have a certain amount of things we do not like, of stress, of bad mood, of being anxious. So what's going to happen if I have lots of pain to my stress here? But if I have more stress, I have more pain. If my pain, my anxiety goes up. If my anxiety goes up. The last thing, and most importantly, is to actually, we ask the kids to normalize the life first before the pain gets better second. It is not the other way around, and that is clearly something our brain does not want to believe. What did I say is going to happen to your pain if you normalize your life? I think it's going to go down, and then eventually it's pretty much going to go back. Pain on its own is actually quite useful, right? It tells you when you're about to harm yourself or you have to fix something. If putting my hand on a hot stove hurts, well then don't put your hand on a hot stove. If walking on broken glass bare feet hurts, well then don't walk on broken glass. So we clearly are triggered the way to avoid pain. So I cannot promise you that you're going to be pain-free for the rest of your life, but you will be back to normal like pretty much everyone else. Not being able to feel pain actually would be bad. Does that make sense? So why even bother, right? It's just this little bit of pain. And now we have more and more data actually showing us that the kids actually who are suffering from pain turn out to be adolescents or adults with big pain issues.